Projection of Philippines stand for mental health. Have you ever heard the phrase, what mental health needs are more sunlight, more candor, and more on-stream conversation? The American actress Glenn Close said. After hearing it, have you imagined how that matter would be solved by communication? Have you thought about how it goes by as easy as 1, 2, 3? Close wants to emphasize that issues in mental health must be tackled as a day-by-day conversation. But it's not that easy. The process of addressing this issue is not that hassle-free, and at some point seems to be impossible. Environment, even the society, is suffocating. It's in the daily routine of humans to experience anxiety, apprehension, and fear. That's why the majority still choose to keep their ears closed while listening to mental health issues. Many still choose to remain silent after experiencing or while experiencing the extreme mental and emotional abuse in their everyday lives, and people are still blind and continue to shun the truth about this issue. In fact, in the Philippines, those in power still do not directly consider mental health issues as the country's major problem. The public does not have enough knowledge on topics under mental health. People are still not educated on the difference between sadness and depression, and the proper way to analyze it. The country still does not have enough establishments to address those who suffer from anxiety, depression, and related disorder. There are only 2 tertiary care psychiatry or major hospitals that address the people experiencing mental health issues. The National Center for Mental Health in Mandaluyong City, Metro Manila, has 4,200 beds, and Mariveles Mental Hospital in Bataan, Luzon has 500 beds. Such facilities are not enough to address the ever-increasing number of mentally ill people recorded by the Department of Health, which is exacerbated by the current pandemic. At the height of fear during COVID-19, the 500 beds capacity of Mariveles Mental Hospital was split to pay attention to patients with COVID-19 related sickness. Imagine how limited the 4,700 beds were for the mentally ill patients all over the country, and became more limited as Mariveles Mental Hospital capacity was divided to allocate half of its COVID-19 patients. In the 2021 Philippine budget, there is 615.5 pesos set aside for the country's response to mental health program. With the country's current population of 108 million, it appears that there's only 5.69 pesos budget for every Filipino, and that means that the budget is smaller than the budget per capita in 2017, which is 12.19 based on the estimation of Marikina 2nd District Representative Stella Kimbo. With almost 6 pesos allotted to each individual, it is no wonder that Health Undersecretary Myrna Cabultahi of the Public Health Services team says that the budget is very low for mental health program. Now the fact I have stated are just some of the things that the public should be informed about. Not surprisingly, many psychological practitioners see mental health as the second wave of a pandemic due to intense feelings of uneasiness that will be driven into anxiety and depression. The mental health crisis is not impossible anymore, especially when the public is lacking programs and awareness that will help them to comprehend the issues and concerns related to mental health. What Glenn Close said was not wrong, but that everything can be fixed by words you heard are worthless if not accompanied by proper action. In the end, applying remains as the best training.